Hi, you are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us.
Hello, and welcome to another exciting episode of In the Ladies' Room with Dr. Donica. Now, today we're going to talk about a new survey from one of my favorite organizations, HealthyWomen. And it reveals that moms still feel pressured to do it all and continue not to prioritize their mental health and well-being. We needed a study to find that out. Seriously, any new mother could have told you that. But in all seriousness, research does show that women are more likely to experience postpartum depression, aka PPD, if they don't receive enough support from family, friends, or community after giving birth than women who do receive that kind of appropriate support. Now, about 1 in 8 women in the United States report experiencing symptoms of postpartum depression each year. And therefore, there's a greater need for what we're starting to call the fourth trimester care. And the fourth trimester is the 12 weeks after baby's birth. And what we're talking about is how can we improve planning and support to help women during that time period. And we're also going to talk today about what we're going to do about it. So what I love about HealthyWomen is they not only provide the information that we need, but they also provide actionable programs and activities. So they've launched a new campaign called Check In on Mom, which helps new and expectant mothers create a maternal mental wellness plan. God, shouldn't everybody have that? And designate a group of trusted friends and family. I'm calling this the Mom Squad, who are empowered to help her through the postpartum period. Now, we're not letting dads off the hook. Dads still really should be involved. And of course, women who don't have involved partners, whether they're dads or other partners, they're also at increased risk for postpartum period. And we're also going to distinguish today the difference between postpartum depression and the baby blues, which are extremely common and very different. So here to discuss all of this with us today is Dr. Kristina Deligiannidis, Director of Women's Behavioral Health at Northwell Health. If I read you her whole bio, we wouldn't have any time for the podcast. So all I'm going to tell you is that she's a national leader in the field of perinatal depression, and she's going to explain what perinatal depression is, and novel therapeutics research. Her research program includes a focus on psychoneuroendocrinology, particularly neurosteroids and hormones, and neuroimaging in women's behavioral health. Her list of awards and peer-reviewed publications and textbook chapters, et cetera, are exhaustive. So you're just going to have to trust me on that. And with that, please welcome into the ladies' room, Dr. Deligiannidis.
Well, hello, good afternoon, and thank you so much for having me. It's just so great to see you and to have this time to talk with you and share time with your listeners as well.
Well, thank you. And I hope you are enjoying a happy holiday season. We're still in the midst of the pandemic, while we're taping this. And speaking of mental health, how are you doing through this pandemic and your family?
Yeah, we are using a lot of wellness techniques in this home. A lot of mindfulness apps for the children and for myself, and making sure that we're getting exercise. And I go around and make sure everybody's getting their allotted sleep that they should be getting. And we're just trying to build the resilience during this unprecedented chronic stressor that we're all living through, and the challenges that it's bringing, because we just don't know when this stressor is going to end. So we're staying focused on resiliency and maintaining wellness and just supporting each other. And I guess going right back to how important support is during times of change and stress.
And for everyone.
Exactly.
And so that means everyone in your family stayed healthy through the pandemic.
Nobody did.
That's awesome.
That's right.
Your children are how old?
They are 11 and 15, and we're all fully vaccinated.
Yay, because that was my next question. I was going to put you on the spot because I don't ask these kinds of questions in advance. I do have a bias that I assume that most physicians who have children make sure that they get vaccinated. Although I did just see a study that at this point, 70% of physicians who have children have fully vaccinated children. The problem, of course, with that study is they didn't talk about how old they are. So obviously, if you have a 5 to 11-year-old, and even you're the most dedicated physician, they're not fully vaccinated yet. Or if you have a younger than 5, obviously, they're not vaccinated at all.
Yeah, my 11-year-old just got his second vaccine Saturday, and he was on the early, like he went in very soon once things opened up. So yeah, we encourage everybody to practice on wellness, but also take advantage of how we can keep ourselves safe.
Yeah, well, I needed you in this house during the pandemic because my focus on wellness and mindfulness behaviors was focusing on chocolate and ice cream. So it's not a very healthy behavior, but I have since turned that around.
Well, we do a little bit of both in this household.
And Diet Coke, drink of champions. My children are much older. And of course, I made them, they were very quick to get vaccinated as soon as their groups were called up. But my son was in college when the meningitis B outbreak hit several universities. And his college was able to get emergency use authorization for the first meningitis B vaccine in the United States. It had not yet been FDA approved. And I texted him, if you're not first online, you're going to have to worry about mommygitis, not meningitis. But
there's a vaccine for that.
Talk about vaccine records. Their university had 92% of students vaccinated for meningitis B within 1 week.
Wow, that's within a week.
Within a week. So, very interesting. So now let's switch gears from, other stressful mommy topics from, shepherding your children through pandemics and homeschooling and, all of the other drama that comes along with being parenting in a pandemic. Oh, that would be a great book title, Pandemic Parenting. We did a previous podcast episode, which we called Pandemic Sex, but I didn't do Pandemic Parenting yet.
Add that to the list.
Now to this Check-in on Mom program. First, tell me about what is the difference between postpartum depression and the baby blues? Is it the same thing? What's different?
It's a really important question. And to be honest, there's a lot of confusion, with the women that I care for, with their providers, their clinicians that refer them. They're not sure who should be referred to seek additional care. So there's quite a lot of confusion around there. I'll start with perinatal depression, or depression that can start in pregnancy or after birth. So
first start with sorry to interrupt you, but that's what I do. First start with telling people what perinatal means. I think that's a little bit confusing to people.
Yeah, so that perinatal is during pregnancy or after delivery. And so it encompasses both periods. And, we as a field have moved away from postpartum depression because we really realize that many women have symptoms while they're still pregnant before they deliver that baby. So perinatal depression is clinical depression that really has functional impairment to women, again, during pregnancy or after delivery. And it can be differentiated from the baby blues on a variety of variables. So severity, the onset, and also the duration of symptoms. So the symptoms that women can feel are pretty similar, but they differ on severity, onset, and duration. So moms will say that they really, having periods of sadness or a loss of interest and pleasure in the things that they used to enjoy. They're not reading like they used to. And you get it, like moms are busy,
I don't
right?
know anybody who was reading like they used to after they have a baby.
Not after they have a baby, that's for sure, right? Not with the Q2 for 2-hour feeds. You're not going to be doing much of anything but feeding that little one. So, and trying to get a shower in during your day, if at all possible. But yeah, periods of sadness. Yeah.
So when I was a new mother, my theory, and having trained in OBGYN prior to having children, I knew nothing about the postpartum period. So I learned everything that I knew having children myself. And what I learned was that and I was very arrogant as I approached it because everybody was telling me about the sleep deprivation. And I was like, oh, I know all about sleep deprivation. I was an OBGYN resident.
Of
But
course.
even in my worst times as a resident, I was only on call every other night. I
Right.
wasn't on call every night.
For months.
And the exhaustion was, striking. And my theory was that a lot of the mood symptoms were really from sleep deprivation, but that you really wouldn't be able to ever study this because where would you find a new mother who was not sleep deprived?
Well, there are moms that are sleep deprived and don't develop depression. And so, yes, for some, the sleep deprivation is a trigger, and for others, it's not. And so, but sleep is an important piece both in pregnancy and after delivery. And so, for perinatal depression, women will report, for postpartum depression or perinatal depression, really, day after day, feelings of sadness, low mood, or blah mood, also anxiety, anxious feelings or irritability, feeling on edge, loss of interest and pleasure in things, loss of appetite, really having to force themselves to eat. Some women will feel a zoom in their appetite or they're eating more, but many women that I see really almost have to be reminded to eat. The appetite is just turned off. They don't have that hunger anymore. The sleep is disturbed, whether you're a healthy perinatal woman or you're experiencing depression or anxiety, but in different ways. And so healthy women who have some, sleep disturbances still feel fairly rested, even though they're, maybe disrupted at night because they're tossing and turning or peeing a lot. But a depressed mother really has difficulty falling asleep, staying asleep, and then sometimes they wake up at 4 a.m. and just can't get back to sleep. So it's more intense. It's just more severe. But also they have difficulty with concentration, which is much more severe than just mommy brain, because sort of that fogginess that you feel in pregnancy and after you deliver a baby. It's being indecisive, it's being forgetful, not being able to multitask, and the exhaustion which you had referred to with the sleep deprivation also is a very different feel. And so that feel of quote unquote being on call with your newborn every 2 hours of feeding is different than women who even during that off period can't sleep. And so they're just exhausted all day long, and so exhausted that sometimes brushing their teeth is a chore. Like it's just too much work. It's too much work to take a shower. And so women will have, a variety of these symptoms. They can have also feelings of guilt or worthlessness. And some women with more severe depression can even have thoughts of kind of understanding that they're not feeling right, and then wondering if it's even worth, if they're living, if they continue to be around anymore.
And what about thoughts about hurting the baby?
So that's much more rare. For what we consider perinatal depression, or this unipolar depression, which is different than bipolar disorder, which is a different psychiatric illness, different disease. That's much more rare of feelings of harming their infant.
I'm not talking about feelings of wanting to harm the infant, feelings of being worried that you're going to harm the infant.
Now that's different, right? So the feelings of wanting to harm their infant is very, very rare in perinatal depression, but having a lot of anxiety about harm coming to the infant is really common, and it keeps so many mothers awake at night, checking on their infants over and over to make sure they're breathing, having a lot of intrusive, anxious thoughts about potential harm that may come to the baby, or illness, or if they don't do things just right. We see a lot of those anxious thoughts, especially in women who have some maybe history of anxiety, prior to the pregnancy.
Mm-hmm. So talk to us about risk factors. We talked in the opening about lack of a support system, certainly lack of a partner or an absent partner. But what are other risk factors?
Yeah, I would say one of the biggest drivers is a personal history of depression. So for women who maybe had a bout of depression, early in their lives, either as a teenager or maybe in college, or later as an adult, that itself is a significant risk factor for developing an episode of depression during pregnancy or after delivery. But other ones are family psychiatric history. So mom having a parent with depression or other psychiatric illness are other important risk factors for postpartum depression. Obviously, the support system, you mentioned the HealthyWomen survey, and you're right, like, didn't we already know this? There's actually quite a bit of research on this, that if women, don't receive, sort of maximal support from families, friends, or community, it decreases their ability to have a buffer from the stressors around them. And so when women do experience increased stress, no matter where that's coming from, without that support network, that additionally is a risk factor for postpartum depression. And then my research group also studies if sort of the sex hormones of pregnancy. Why is it that some women repeatedly develop depression during pregnancy or after delivery? Is there sort of a hormonal trigger that is setting them up to develop postpartum depression?
Or is there a
there's many
hormonal
things.
protective factor? So talk to me about the difference in postpartum depression between women who breastfeed and women who do not.
Yeah, so, we definitely need more research on this. I think in the past, everybody unfortunately just, thought that, oh, everybody is super happy during pregnancy. Why wouldn't you be happy in pregnancy? It's a glorious time. And after you give birth, it's just glorious and you should be the happiest person, on the planet. And there are still some cultures where this is a very strong factor. But, we really do understand, and this is a source of a lot of stigma for women, because there is this sort of thing, well, you should be elated because you're pregnant, and social media feeds into this too. Is there protection? We really don't see that pregnancy per se protects women against developing mood symptoms.
I wasn't talking about pregnancy
piece,
protecting. I was talking about breastfeeding versus non.
Right. So in the postpartum, for some women, we know that postpartum depression can actually affect the hormones that support breastfeeding. It kind of shuts down breastfeeding. It makes it challenging. And so they're even more stressed by trying to breastfeed. But asking the other question, is breastfeeding protective? There's some research that supports that, and others that it's not quite clear.
Because we used to refer to oxytocin as the happy hormone.
Right.
So as far as pregnancy making you elated, it did not make me elated, but no longer being pregnant made me very happy. I did not have postpartum depression or the baby blues. I do anger and hostility. Those are my favorite sports. But I do remember just being exhausted. I even confided to a friend of mine who's a physician that I thought I had leukemia, because I could, that was the only thing that I could imagine that could make somebody that tired. Incredible. I was more tired than when I had mono when I was in college. It was way more tired.
I've had women come into me and they just said, Dr. D, they're like, just put me to sleep. All I need to do is sleep for a week and I'm going to be fine. And they're like, just knock me out. Give me whatever medications you can. My husband will take care of the baby. I just need to sleep for 3 or 4 days and I will be okay. And unfortunately for women suffering from postpartum depression, it's not that simple. Like the sleep dysregulation is an important piece of it, but there's other layers as well. I will do a public service announcement for everyone who is 50 and over, or everyone whose doctor has told them to get a colonoscopy, because the best sleep I ever had in my entire life was from propofol from the colonoscopy. So everybody who's afraid of a colonoscopy, trust me, you can thank me later. The prep, not so much fun. Not so much fun, yeah.
The sleep, priceless. All right, so what are we going to do about postpartum depression?
Yeah, so again, there's a lot of research. So education is a big thing of what I do, and what I think we all should do is to educate. We do a lot of education for clinicians, but also for women and for their families and for communities. we don't want women, because they report to us that they don't want to bother anybody with their symptoms. Should they, they recognize that they're not themselves. We want to sort of get around that. We want to prepare women with support before they need it, if they need it.
Mm-hmm.
And so this Check on Mom program, it's mycheckonmom.com. It's a program that's really preventative in nature and educationally based. It's really focused on helping new moms and expectant moms to create that maternal mental wellness plan that you had mentioned. And, this can be started in pregnancy or in a plan for the first 12 weeks, after the baby's born. The website, has a program where I love that it's very personalized. So moms come into the website, they create their plan, and this, they create their mom team, their mom squad, and they take the time to identify their personal needs, the everyday to-dos, the priorities that they might want help with when the baby's born. And so, you can think about creating this network of friends, family, community, people who are near, people who are far, people who connect with you via text or video or phone or a neighbor.
Or Facebook.
Yes, anything. And because we have so many ways to connect now, let's bring all those people together, but let's do it before the baby's arrived, not after, and you have not slept in how many days. So thinking ahead, who can help out with laundry or pet care or,
or your other three children.
Errands. Exactly, other children. But then also, how can mom, we talked about the resilience, building resilience, focusing on wellness. What's important to each mother? So how does mom get a night's sleep? How do we deal with the feeding overnight? How does we make sure that mom gets to take a shower every day, brush her teeth? And, these are really practical things that, you're right, no one ever told you it was going to be challenging after you gave birth. So mom creates this plan and then identifies her mom team. There's also, so that mom team they get these really beautiful bracelets, and they're reminded to check on mom. They get texts, inspirational content, but also mom is supplied, and her partner and her community of mom supporters, her team, is also given the resources to understand the signs and symptoms of postpartum depression versus the baby blues. And there are trackers. And then also to help, we also know that there's also a barrier of women reaching out to their clinician, of having that discussion with their clinician if they think they're suffering from postpartum depression. And so there are great educational guides and materials of how to have that difficult conversation with your clinician, because your healthcare provider is the best person to kind of help you figure out what's going on.
So one of the things we know, certainly the survey bore this out, is that women are not great at putting themselves on the top of their to-do list. Others are way worse than women in general.
Yes.
And the other thing that a majority of women, especially mothers, don't like to do, perhaps because we feel like conditioned that, this would be weakness, is we don't like to ask for help.
Right.
So one of the things that I always felt, whether it was when I was postpartum or post-op from various surgeries, including 2 C-sections, I almost didn't like it when people would say to me, what can I do to help? And there was always this little voice in my head saying, you're a grown-up, figure it out. What I prefer is if people come to me, rather than saying, what can I do to help? They come to me and say, how about I take your other child to the movies next week, and you can focus on this. Or how about I bring, takeout, Tuesday night for dinner, or whatever it is. I'm going to the grocery store. Do you need anything? Those kinds of things. I think the more specific people can be, or the more they can offer, better it is.
Yeah, because you're addressing one of the barriers, right? By doing that, by having, your support team come to you with the help. It's not, there's no guilt in doing that, of accepting that, of them coming and saying, hey, I'm going to do this for you. And you're like, okay, great. Rather than, oh, would you mind, picking up picking up some milk because this milk has been rancid and no one can drink it. And, like,
And it's psychologically, it's interesting because the things I'm reluctant to ask other people to do for me are things that I wouldn't hesitate to do for them in a heartbeat.
absolutely. Mhm.
But for some reason, it's such a big deal to ask somebody else to pick up milk on their way home.
Right.
Or,
right.
could you bring in the trash cans?
Mhm. Mhm.
And there are
Yeah.
very few people in my life who I would feel comfortable asking them, could you help me with Mount Washmore?
Right, right. And so this, the My Check on Mom program that's what it has in mind, is making it very specific, and also that it's just set up, right? So the nursery is set up, hopefully your birth plan is set up, right? You've got all these other things set and ready to go. This is just going to run on autopilot, and the support is there. Again, kind of, you don't need to ask for it. It's just going to be there for you. And everybody's transition to motherhood or to having their second or third or fourth is different. It's sometimes different with each child. And so just having it there, knowing it's there, just again, it's reducing risk factors, and it's empowering women and supporting women, and raising women's health. So it's just, I love the perspective of it, and it's not putting the onus on the mom, to ask for the help when she's already struggling so much.
So one of the hallmarks of depression, whether it's postpartum depression or any kind of depression, is that you lose some degree of your perspective into what is going on with your own behavior. So oftentimes your mother or your partner or your best friends are much more aware of what's going on with your behavior than you are. So give me like top 4 things that, my best friend just had a baby. I suspect that something is not right. What should I be looking for, and what should I then do about it?
Yeah, so I would say that most people pick up on the lack of enjoyment, right? I mean, most moms, even when they're stressed or even if they're having baby blues, within the first 2 weeks of delivery, because that's the time period for baby blues, moms are still really excited that they have a newborn and that they've delivered this baby, and with all of that, there's still that joy and that happiness. And so for moms without postpartum depression or baby blues, they still have that. For moms who are clinically depressed, their friends and their family pick up on that. They pick up that they're not smiling, that they're not maybe smiling at the baby or looking at the baby or holding the baby, and engaging with the baby.
Or bragging about the baby.
Yeah. Yeah. The baby pooped today, right? Look, it was the most beautiful poop you've ever seen out of a baby, right? So, I think that spark of joy, instead it's filled with dread and with uncertainty and anxiety. I think that's one of the biggest ones. Another one is, I would say, moms who can't get out of bed, moms who are struggling to take care of their, every postpartum mother deserves to not have their hair look like, they've come out of a salon.
This is why God invented ponytails.
They can be in whatever leisure wear they decide and be fashionable. But these are moms who, again, aren't really bathing or combing their hair or brushing their teeth. They're too exhausted to really eat anything. Even if someone prepared a meal for them, they're not really eating anything. So sort of these, without even getting into, are you feeling sad or blue or down? Are you feeling guilty? It's almost the external things that I think family and friends pick up on.
Okay, and then somebody calls the doctor.
Yes.
Ideally the patient ideally the mom calls the doctor. But it's not unheard of for a partner or a mother to call a doctor and say, what? I believe Sally has is depressed or has postpartum depression or needs to be seen right away.
Yeah.
So it's just like calling the gas company and saying, I smell gas.
Yeah, it can be. Ideally, we want to empower women to advocate for their health and to seek, their healthcare providers, opinion and evaluation, because it is going to take an evaluation. But sure, I fielded calls like that from partners and spouses and mother-in-laws, that are concerned about, someone in their lives who just gave birth.
See, a lot of people are concerned about doing that now because they have totally a complete misconception, pun intended, about what HIPAA means and what HIPAA is.
Yeah.
So just, to kind of clear that up for people, HIPAA means if you're my doctor, you can't give information about me to my mother, but there's nothing limiting my mother from calling you and giving information, unless your mother's a doctor, then you have some issues, but my mother's not a doctor. So there's nothing wrong with that. But we got a little off topic before when I was talking about risk factors, and we neglected to talk about what, in my opinion, is the greatest risk factor for postpartum depression. And when you were talking about people who aren't taking joy in their baby, yes, the majority of women are excited about having a baby, but it's a slim majority. It's just over 50%. Of women who are having planned intended pregnancy.
Oh yeah.
So there's a very large number of women who are giving birth to babies that they weren't really excited about having, or weren't ready to have, or are not financially prepared to have. So let's talk about those women for a second.
Yeah, you still see the attachment because we in our research group we see lots of moms, and we see moms that are not having any mood symptoms, who are moms who intended to have the pregnancy, those who didn't, and what we still see in the moms who do give birth and in very challenging situations. We have homeless moms, we have moms in shelters, we have moms in very cramped, living conditions, who are, bringing in this newborn, who have very limited resources. There's still this attachment and this relationship between mom and the baby, which is really evident. And you do see the stress, you hear the stress, you understand that. But there's something about how they speak about their baby, and that's a little bit, that's really absent. When I see women with postpartum depression, they're not looking forward to a day. Like, they weren't looking forward to their baby shower. They were not looking forward to the baby's arrival. They're not looking forward to really anything in life. It's not just, oh, this was an unintended pregnancy. It has more, the baby's part of it, but in a woman with postpartum depression,
unintended, I'm talking about, I did not want this baby. And of course that, I'm concerned with women having fewer options to terminate pregnancies, that we're going to see an increase about that. The other thing I really want to caution people, when we talk about being aware of conditions and, in helping somebody or intervening, I don't want anybody to think they have to make the diagnosis, whether they have to make their own diagnosis or whether they have to make their daughter's or best friend's diagnosis. Because of course, now let's talk about for a minute, all the different medical complications of pregnancy that could mimic the signs of postpartum depression. And let's start with COVID. It is possible to give birth and have COVID at the same time, which is pretty depressing.
There's a lot of medical ones. So what you said is really key, and I want to just re-communicate it, is that it's just to throw the flag out there, that hey, the mom in my life, she looks a little bit different than she has before. I've noticed X, Y, and Z. And so that clinician can then, when she's seen maybe for her postpartum visit or comes in for an additional visit, then we can start talking about all the different things it could be. And you're right, there are medical things. The thyroid could be out of whack. It could be
thyroid. diabetes.
Yes.
Another
Yeah.
one that's really super common and actually the number one cause of maternal mortality is postpartum hemorrhage, so blood loss.
Yes.
And these are not necessarily women who are hemorrhaging,
Right.
but their blood count just may be significantly lower than it should be.
Yes.
And I mean, there are times you see somebody before a unit of blood and after a unit of blood, and they're a totally different person.
Day and night.
And a unit of blood does not cure depression, but
Right,
it sure
right.
can address a lot of those overlapping symptoms.
And that's why it's just, educate and then have, it's just that so many women, right? So we know that only half the women are detected. There was a study that about half, are clinically detected in, their provider's office. Of those, only half receive any sort of care or treatment or get connected to care. Of those, half get somewhat better, and half of those are fully treated. Like effectively treated. So we're doing a very poor job at this. And so detection is that's the top one. We can't have women get the care and treatment they may need without the identification. And so, whether that is, the woman herself being able to recognize, yeah, I'm not feeling myself. And moms will, it's interesting, for 15 years doing this, and the women will say like week 7 or week 8, I just stopped feeling myself, or day 4 after delivery. Like literally they have the day that they know something changed in them. And so for many women, they can really point it out. They do lose perspective on perhaps how challenging things are and how impairing their symptoms are, because it's really hard to face that. It's really hard to acknowledge that I'm not able to keep up with all the things that I should be able to do.
Well, and it's that shouldism.
Yeah.
We actually had a previous podcast where we talked to a pediatrician who, did a fabulous TED talk on the should storm and how parents face this constant barrage of shoulds, mostly primarily from ourselves. Yeah. Like, we should be dressed a certain way, or we should be wearing makeup every day. Now, the pandemic solved a lot of those issues for us. But even in my own experience, the history is so important. I began having some terrible symptoms when I was about 4 months postpartum, and did go to my doctor, who thought she was very avant-garde, and at the time nobody was really talking about postpartum depression, and said, I think you have postpartum depression. I also had terrible pain on the right side of my body. And I said, well, why does the right side of my body have postpartum depression and the left side does not have postpartum? And plus I also used my line, but I don't do depression, I do anger and hostility. And the punchline in my case, which took weeks and weeks to figure out, I actually had Lyme disease. So yes, it's possible to get Lyme disease when you're 4 months postpartum. It can just happen. Ticks don't discriminate based on whether you just had a baby or not.
Exactly.
So, there could be these other, things, and your symptoms could be a red herring. So anyway, tell everybody the website again.
Yeah, so it's mycheckonmom.com and
mycheckonmom.com.
Yes.
For the people who don't live in New York, we'll say it slowly. We want everybody to go there. We want everybody to learn about this. Certainly women who are pregnant, or if you know or love somebody who is pregnant, or if you just want to learn something. I think that's really important. And I could talk to you about this all day, but before I let you go, my listeners would be very upset if I did not ask you, what was your most unique, interesting, or memorable experience that you ever had in the ladies' room, other than this interview?
Well, as I'm not in the ladies' room having this conversation with you now,
You're in
otherwise it would be. That's right. All right. So the one that comes to mind, the one that kind of rises to the top, I would say it's been some time now, maybe 20 years ago. I was traveling in rural Turkey, and when traveling, I always think it's a good idea to know where the ladies' room is. And as you know, like when you're traveling, sometimes you don't know where that is. So I was traveling in a pretty rural area, and there were very few ladies' rooms to be found. And I did find one. And so I was all excited, and I entered this really small curtained off area. I can only say it was a curtained off area because it wasn't really a room. And because it didn't have walls, and you could feel like the breeze from outside on your ankles, and I, for the first time, encountered what's known as a squat toilet. It was within the dirt floor, and next to it was a gardener's hose that was just like there, and a communal towel. There was no toilet paper. Yeah. So I was prepared. I had my TP in my backpack. And
Which is a great travel tip, by the way, whether you're traveling to Turkey or Trenton, you should always have your own pack of toilet, or tissues or Kleenex or something in your pocketbook, just in case.
That's right. And any mother listening is always going to have, right, wipes, tissues. They'll be prepared. But I was much younger, but I had TP in my backpack, and amazingly, it was not my, it was my first, but not my last experience with the squat toilet, and it became a very memorable part of my trip.
So I have to say, we've done over 150 episodes of this podcast, and so we've asked over 150 people this same question, and I think every single guest who has ever been to Turkey, including myself, has shared the squat toilet experience.
It's memorable.
It's very memorable. But given the topic, I will also say, given your tip about always knowing where the ladies' rooms are before you need them when you're traveling internationally, one of the things that I try to do as a courtesy when I'm traveling in a country that is not an English speaking country is I try to learn the basic pleasantries in whatever the language is of the country that I'm going to. Hi, how are you? Good morning. Thank you. Please. And where's the bathroom? Or where's the toilet? Which is what you're supposed to ask for in other countries, but in the United States, we're a little squeamish about saying the word toilet. So Turkish is the one language I just could not even master. Good morning. I just, because there was no correlation between the sounds and the letters. I just couldn't do this. And I was saying to somebody from Turkey that I was having so much trouble, learning. And he said to me, I don't see why you're having so much trouble. Turkish is a very easy language. Everybody here who's 2 years old can speak Turkish.
There you go.
So, and because of our topic, and because in the ladies' room, I will say just one of my fondest memories as a mother was the first time I was able to go to the bathroom or use the toilet by myself with nobody sitting on my lap. After I had children. That was such a great feeling. Anyway, thank you so much for joining us in the ladies' room. This is such an important topic, and I give you so much credit for being a researcher and helping us learn all about this, and certainly working with HealthyWomen to bring us all of this information. Last time, give us the website one more time slowly.
Yes. So thank you again so much for the invitation today. The website for your listeners is mycheckonmom.com, where they can sign up and learn more.
We have to do it slowly because we have lots of people who listen while they drive. We hope nobody is writing while they're driving, and we hope nobody is actually looking at their phones while they're driving. Stay well, stay safe, and stay listening. Thank you for joining us in the ladies' room with Dr. Danica.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Danica. And please join us next week for another episode of In the Ladies' Room with Dr. Danica. Real conversations with real women about really intimate topics.